In our study, we looked at the impact of the COVID-19 pandemic and its implications for our lung cancer screening program and the eventual diagnosis of lung cancer and treatment for those patients. So our program was shut down in March with the spring pandemic, and was shut down until May 5th. We had phased reopening, and then on June 1st had a full reopening. During the time period, we had over 800 scans that were canceled, and even during the resume period had decreased total volume of patients scanned, and also decreased new patients that were scanned for their lung cancer screening. And these scans are important because they've been associated with reducing the lung cancer mortality by finding lung cancer earlier. Also, when we resumed our operations, we found several things that were kind of interesting and important. We found that new patients were less likely to come back to our screening program. So our new patients getting scanned were significantly lower than they were before the pandemic started. We also found that patients were more likely not to show up or no-show for their CT appointments. And this rate was, again, significantly increased compared to baseline. And also, when we resumed our operations, we found that patients were more likely to be found with suspicious lung nodules, which we categorize as LungRads 4 in our kind of nomenclature criteria. But again, more patients were likely to have suspicious lung nodules when operations were resumed, and they were also more likely to get referred to a specialist for either biopsy or a procedure. More important now, as we're continuing to undergo another surge of cases throughout the country, and how do we navigate that currently? You know, I think there's kind of several elements to that, but we have to make sure as healthcare providers that we're taking care of both patients that have COVID-19 and then also the rest of the population that don't have COVID-19, and that those two patient populations can safely coexist and both safely receive treatment. We need to increase our outreach to patients in the community that it is safe to continue to receive routine and preventative health care and things like screening, and specifically lung cancer screening. And I think the final is, we need to be very cautious when we have to limit or cancel either procedures or diagnostic exams, because they do have potentially negative consequences.